Hospital, Philadelphia, and I'm also a family consultant at the Children's Hospital, Philadelphia. And I wanted to talk to you a little today about patient and family engagement and research and how patients and families can participate in the research process. Next slide, please. So in terms of research, when we think of traditional research, we think of what role does that patient or the parent serve, and especially in the area of autism. I know that my son is 18 years old, and so he's been a part of a lot of different research studies as a research subject, or I've been a part of studies as his caregiver and participating in that respect. But the beauty nowadays is that research is really taking on a new direction. So while patients and families are participating as research subjects, they're also now taking on a new role within the research process, a really important role. They are taking on a role as being an actual part of the research team. So sitting side by side with the researchers and working with them on the project. So different roles that families, caregivers, patients have served on they've served as co-investigators of a research study, consultants, advisory teams, and they're really involved in a lot of different areas of the research. So they can be involved in the writing of the research proposal, or when an investigator is getting ready to submit a grant proposal, oftentimes the family or the caregiver co-investigator will look at that research proposal to see if it makes sense to them. They've been part of the study design, collecting the data. So in terms of how we look at, when research teams are designing how they're going to collect the data from different patients and caregivers, how is that data collected? If it's collected in a waiting room, is that going to be helpful for a family? Is that going to be hard for a family who's in a waiting room with a child with autism? So they're able to weigh in on that type of information that the research team is going to need. Help in interpreting the information that's collected for the research study. And also very important is the dissemination. So once the study is completed and an article is published, or there are findings, there's presentations done, that caregiver or that patient really takes a front seat in helping to disseminate the information and get it out to the communities who really need that information. So getting it out to different community groups, different schools, different families who will benefit from the research being done. Next slide, please. So research done differently. I know that I've seen some of the other presentations that the ATN has been working on. So I know that the terminology or the acronym of PCORI is not a new one. It's really the Patient-Centered Outcomes Research Institute is really kind of spurring on a lot of this research done differently, where now instead of researchers doing research for patients or on patients and families, it's families and patients are participating and they're part of that research. They inform that. So it's patient-centered outcomes research. It's looking at how I am going to make informed healthcare decisions. So it's allowing the patient and the caregiver to have their voices heard in really assessing the value of those healthcare options. So this type of research answers some patient-centered questions such as, for instance, what are my options? What are the potential benefits and harms of those options? So it's me being able to look through the research that's done and really making a very informed decision. A lot of the patient-centered outcomes research has really taken really a very strong turn in the positive side with the Affordable Care Act. That's been a big push, is that the patients themselves and the families are an important part of the research process. So, for instance, the Patient-Centered Outcomes Research Institute, they have a large part of their proposal involves showing how the research team is going to be utilizing patients and families in part of their research process. So not as participants. They want to see how you're going to be engaging patients in terms of that, collecting the data, looking at research proposals, disseminating information. That's a very important piece of how they look at research proposals and how they award the grants that are given out. There's actually an engagement rubric that they use that really demonstrates to the researcher what does it look like to engage patients and caregivers in this process. Next slide, please. So I like to say that we all play a role in engagement. So, when I first started this process, and I've been part of PCORI grants from when they started with the pilot grants about 3 years ago. And when I first started in this role, I have to say that I used to always talk to my team about how I need to be educated on a lot of the terminology that's being utilized so that I can fully engage with the process. And they very quickly corrected me and told me that as researchers, we also have a role in the engagement process. So it really is work on both sides of the team. It's work on the caregiver and the patient end to help educate themselves on what they're going to be talking about in the different research meetings, to familiarize themselves with some of the acronyms and terminology used. And it's also important for the researchers to understand how to engage patients and families. How do you help them feel comfortable and make them feel like they are an equal part, they're an equal part of this team, so that they are an expert, just like you as a researcher, you may be an expert in the data and in the area that you're studying. So for instance, autism, you could be an autism expert, but that a family member or a patient is the expert in what it's actually like to have that condition or to live with somebody who has that condition. So they are their own experts. So as researchers, how do they make this transition to engage research, patients or families as research participants? How do they make that transition to engage them into research partners so that they are really a part of the team? It's helpful when a research team can identify a patient or a caregiver partner who's had experience with the disease. So for instance, if it's an active autism family advocate who has been a part of the clinic or has been involved in ATN, they would be a person who've had experience with this disease. Lots of families, lots of patients have been involved in other projects in the past where they've demonstrated the ability to really think through the appropriateness of their experience to others. So whereas I could talk about my son and my experience with him and autism, it's really the ability to think past that and to be able to relay my experience, but also be able to bring in other people, other family members who bring in a broader, they bring in more of their own opinion. So how do we take our experience and generalize it and bring in other voices that are going to be really important to the process? So it's also very important for a research team to be able to engage that patient caregiver partner really early in the research process. Having partners to either be able to help write or to even read over the proposal to see if this is something that they would even be interested in, or if the study makes sense, is really key in terms of involving that patient caregiver partner early on in the process. Because we could go through, the research team could go all through this whole process, and then when it comes to dissemination, you have a lot of community groups who are saying, well, we wouldn't have really wanted to know an answer to that question. So by engaging that partner early on, you're really getting to learn what the community as a whole who are living this condition or living through autism, really what topics are important to them. It's also very important for a research team early on to fully define the role for the patient caregiver partner and to set those expectations, so those time commitments. Some family partners I know serve as consultants on different research projects. Some serve as co-investigators. Serve as co-investigator may take up more time, so that may mean that they need to commit to a biweekly meeting. Whereas if you're a consultant, you may need to commit to maybe every other month. But really set those expectations early on is going to keep patients and families. Oftentimes you'll find that families will want to do anything they can to help advance the cause. They want to do anything they can do to help. So they'll oftentimes volunteer and say yes to a lot of things. But to set those expectations ahead of time so that they're not overcommitted is going to be really key. And also helpful in explaining to them, this is your role in the project, this is where I need help. So I'm going to do, for instance, a proposal. I need you to look at the proposal, and I want you to look at it from a family's perspective. So setting those roles and the expectations are very helpful in engaging the family or the patient partner. Next slide. Again, other suggestions for researchers in terms of making that transition from having, a patient or a family participant be part of the research team is to empower that research partner by acknowledging that their expertise is in the autism spectrum disorder due to their experience with their child. So whereas the primary investigator on a research study may have had years and years of training in autism, you have, as a parent or a patient partner, research partner, you have your own expertise in those years of living with ASD or in terms of caring for somebody with ASD. That's an expertise that you can't ever learn in school. And because of that unique perspective, you serve a very important role on that research team. It's also helpful when researchers can check in frequently during team meetings. Lots of times, I have heard in different research projects I've been involved in from different patients and different stakeholders who sometimes are afraid to raise their hand and say, they don't want to interrupt the meeting, so they don't want to interrupt it and say, you know what, I really didn't understand what you just said there, or I didn't understand that acronym. Can you define that for me? So it's helpful for the researcher to be in tune with that and to do frequent check-ins during those team meetings, to check in around the room, say, just want to make sure we're all on the same page. This way you ensure meaningful engagement, so you don't have that patient or that caregiver just in the room kind of nodding their head, that they are really understanding what is going on so that they can give you valuable feedback. Providing basic research training can also be helpful to families or patients who are participating. So talking about, introducing the team to common terms that may be utilized for your specific project. I'm part of research projects where we've had introductory webinars for the different participants. So that includes clinicians, caregivers, patients, so that we can all familiarize ourselves with the different terminologies that we're going to be utilizing throughout the research project. Very helpful to really set those expectations early on so that everybody's on the same page. Also very important is to provide that research partner with enough knowledge to understand what they're doing and why it's important. So if mathematical concepts are being introduced, which oftentimes they are in a research project, explain to them ahead of time, explain to the families or the patients ahead of time, this is what we're going to be talking about in the next meeting, and here's what we need you to hone in on. Here's what we need your feedback on. It's very helpful to understand ahead of a project for a patient or a family who's participating as a research partner to understand why this is so important, why your feedback, and why we need this information to help other families to set those expectations ahead of time, really help define their roles. So for example, I've been participating in a PCORI funded project where we're looking at sleep health. And part of the pre-work has been the clinicians working with the youth and the family partners at educating them about sleep health and educating them about sleep disorders, as well as the current measures we have for sleep health that are out there that clinicians are working with that are helping families, but then where we're lacking, where we need more measures, where we need more information. So they really set expectations with the youth and the caregivers who are participating that these are the areas in the research of where we're missing. Here's why we're doing this work, and here's where we're going to need your help with this. So this is why your role is very important. Next slide, please. When possible, for researchers, it's very helpful to send the agenda and any material in advance ahead of time before a meeting, because it allows for some pre-teaching time for any material that the research partner may not fully understand. I have oftentimes been given material for different research meetings about a week ahead of time. I go through it very carefully, and if there are any terms or if there's any concepts I don't understand, I have a point person within our research team who I'm able to connect with, and they do the pre-teaching with me ahead of time so that when I'm in that meeting or when I'm on that research call, I'm able to really fully understand what they're talking about and the terminology so that I can weigh in and give meaningful feedback. And then the research partners themselves, the family members, the patient partners, they have a really valuable role in the translation of the research that is going on. They have the ability to really decipher and interpret that information collected by the research team, because they're the ones who are able to see it through the lens of either living with the condition or caring for a person with ASD, caring for a person with that condition. So they're going to give that valuable feedback where you may not have that from other members of the research team who do not have that same expertise. As well, in terms of dissemination, research partners, research family, and patient partners, they have a really valuable role in disseminating the findings from the studies that are being done, especially the studies that they're a part of, that they played a role in from the very beginning. They are the stakeholders in their own disease community, and they are the ones who have access to other patients and families. So very important when it comes to dissemination. Nothing about us without us. They are the ones who live with the condition, and they are the ones who are going to get the information out to the families, the communities where it can be helpful. Next slide. So what is now I've talked about the researcher's role in all of this, or how a researcher can engage a patient or a family caregiver in the research project. So now what is, if you're a patient or, you are a family, you're a caregiver or a family member for somebody with ASD, what is your role in the whole engagement process? Some of it I talked about a little bit, where you are that expert in your child with ASD. You bring to the team a voice that they're not going to learn from books or from classes or from any other areas. They are going to need your expertise as caring for a child or being a person who is living with ASD. And as such, you are a valued member of that research team. It's really, really important to understand the abbreviations and the terminology being used to meaningfully engage. So for instance, researchers can do their part by checking in and making sure everybody's understanding and we're all speaking in, using the same terminology and we're all on the same page. But as caregivers or patients participating in this part of the process, it can be really intimidating to raise your hand and say, you know what, I didn't understand what that acronym means. Or can you explain what you mean by subdomains? You're sitting in a room full of researchers, and sometimes it can be very intimidating. However, very, very important, if a researcher is not always checking in or isn't checking in frequently enough, and there's something that comes up that is not understandable, to be able to speak up, to stop the discussion, and to ask the facilitator to clarify or explain what they're saying. Oftentimes, that can be one of the most intimidating parts of the process when you're first starting to engage in different research projects. But when you start raising your hand and saying, can you stop, can you explain that to me, lots of times there are other people sitting at that table, even researchers, who weren't fully understanding that either. So it's really helpful for everybody sitting at the table. And again, ask for those meeting materials ahead of time. Try to, if there's agenda set, if there are certain parts of the research study that you're going over at a specific meeting, whether you're looking at the research question that's going to be asked or how you're going to be gathering data collected, to get that information ahead of time, determine if there's some areas that they're going to be discussing that you may need further explanation on. That way, when you engage and when you're part of that meeting, you are really a full team member and you are an important part of the team sitting at the table, and you're meaningfully engaging with everybody and able to give them the valuable feedback that they're looking for. Next slide. So that's, in terms of getting the information ahead of time and in terms of speaking up, that's really where, in my opinion, we really move from being that checkbox and check, we asked a family member or we asked the patient if this sounds good, into really meaningfully engaging with the whole process. It takes more time. It's going to take more time for the research team. It's going to take more time for the patient or for the caregiver, but it's really crucial for the process. That is why that training, the pre-teaching, the setting expectations, preparing that patient, caregiver, research partner for the meetings is so crucial. The more the patient or the caregiver partners understand about the project, the more they're able to give valuable feedback to the process. So, for instance, this PCORI project I had just referenced, the webinars that the clinicians gave in the beginning of the research project has been so important for the parent participants and the youth participants to understand where they need to give their feedback for this process. It really helps us understand where in the research where there are gaps and what this research project is going to address. So it gives us a background of where we need to give that valuable feedback. And then again, in another area, as the family and as the youth participants in this project, we are going to be doing a webinar on educating the clinicians and the other research partners on our project as to what life is like in terms of living with a sleep disorder. So again, very important setting of expectations and pre-education as the research project moves forward. Next slide. So this is just an example of a successful model that I was really fortunate to be a part of. That's me on the right-hand side of the screen. And Catherine Bevins, who is one of our researchers here at the Children's Hospital of Philadelphia. And Catherine was a primary investigator on a PCORI pilot grant. I served as her co-investigator, and that's actually my son in the middle there. And this was a really wonderful example. This was my first time getting involved in the research process. So when Catherine first approached me and said, do you want to help me with this research project, we really need to recruit autism families, I thought, okay, great, you need me to help with getting participants for your study, or putting flyers up to recruit participants. When in turn, she really wanted my feedback to help design the study, to help format, to help look at the research question, to help gather the data. So how this looks to us is, next slide. So this was our engagement infrastructure, which, if you're looking at it from a researcher's point of view, is, it's something that's being done now more lately since PCORI has come into existence. But this is on the newer side, and this is really where we are, as you can see by the whole infrastructure, we've really level set in this project where the researchers and the family partners are equal partners in this whole process. We had our different cores. Our project is actually wrapping up at this point. We had our different cores. They were co-directed by a researcher and a family partner. And as you can see, the part of the participants who made up the different cores were patient and family advisors, scientific advisors, and we also had patient advocacy and support groups. So everybody played an equal part in the research project. So how did this change what we did in terms of the research and in terms of how the project went? Next slide. Well, what we learned was we learned a lot from working with family partners and from engaging them from the beginning. So when Catherine was first looking at her research question and what she wanted to learn from families, she went directly to the family advisors, so the members of our team who acted as consultants for the research project. And we utilized the family advisors to help us understand what kind of question we needed to ask. So how we started this was we were assessing family perspectives. So we wanted to know what an ideal outcome would be for a patient or a family member for 6 common pediatric diagnoses, one of which was autism. So we went to our family group and we said, this is the question we want to ask. What problems would you like your child's treatment to address? So we went to our group with that first question. If you can click on the next part. They, in turn, because they were involved from early on, said to us, we don't like the way you're asking that question. You're referring to this as problems. We have a preference for a positive focus. We don't want you to ask us questions about our child's condition and have it be negative. So again, these were families who have kids with autism, who have kids with asthma, who have kids with juvenile rheumatoid arthritis, really from families across different diagnoses who were all saying the same things. Please ask the question with a positive focus. If you can click again. So then we further refined the question, and as a research team, we went back to, okay, they wanted a positive focus. Here's how we're going to change the question. How would you like your child's treatment to improve his or her life? Again, we didn't roll this out right away. We went to our group of family advisors who were a core part of our research team, and we asked them, well, what do you think of this question? Does this seem better to you? Does it put it more into a positive focus? If you can click. And what we heard from them was that treatment facilitates a focus on the symptomatic outcomes. They also said to us loud and clear that you really need to consider the impact on the family, not just the child. And this question, the way you're phrasing this question, does not address that. We heard this from families who have kids with autism to families who have kids with asthma, ADHD, juvenile rheumatoid arthritis, was that overall theme that you need to be more specific. If you can click again. So this was the question that we ended up asking, and the final research question was, when they did interviews, was a lot of research involving children with ASD focuses on learning and communication challenges. ASD impacts kids in other ways too. How does your child's ASD impact his or her life? How would you like that to change? So they were able to probe specific life domains. They were able to look at school with friends, how he or she communicates. And the beauty of this in having our family advisors be an integral part of really changing the research question we were asking, we had outcomes that were really amazing. So if you can go to the next slide. So as you can see, we heard from families, and and again, in looking at the literature review, in what we thought we were going to hear from families and what we heard from them were very different. So where we really saw a big discrepancy is between the importance of the different outcomes that were identified in terms of the aggressive behavior. So whereas when we looked in the literature, we saw that previous research that has been done has identified aggressive behavior as being a really important outcome that's prioritized. But really, when we went to the families, when we went to the caregivers, and we asked them in a way which really talked about that positive focus, and again was formulated by stakeholders, we were able to learn a lot of different things. We had a lot of families who actually rated aggressive behavior and conduct problems lower for their outcome priorities. And where they related outcome priorities as being a lot higher was making friends, forming relationships. We heard over and over again from families about the need for their child to have meaningful relationships in their lives, that was most important to them. So these were all outcomes that we were able to get to because the family advisors and the participants in the research project helped inform what the research question was and what we were even asking the families. Next slide. So I just want to wrap up by saying that families and patients play a really integral role right now in the research process. It's a really opportune time. The Affordable Care Act and the Patient-Centered Outcomes Research Institute is really shining the light on, again, nothing about us without us, that the research process really needs to be done with the caregiver and with the patient sitting there at the table so that they can have an equal voice at the table and they can give valuable feedback and really change outcomes or really change what we're doing research on, what's important to us as people who are living with the condition or people who are caring for a child with ASD. This is all expertise that, you can't get from a book. But in order for a family member or a patient to be able to engage in this process, a lot of that pre-work, a lot of that level setting, a lot of that validating their expertise is going to be a crucial part of the process. So I want to thank you all for your time.